Good evening, team. My name is Jay Udasi. I'm a practicing physician and right now recording this video presentation in regards to a healthcare symposium as an MBA student at West Texas A&M University. I chose this article titled Poor Communication on Patients' Medication Across Healthcare Levels Leads to a Potentially Harmful Medication Errors. The authors of this article are Karen Friedenberg and Mary Brecky. The reason I chose this article, the medication errors are very dear and near to me because I deal with that problem on a daily basis in a hospital. It's amazing that we all know that this is such a sensitive and important topic, and we all have to be very careful not to make any mistakes in prescribing, delivering, administering, or even explaining the patient about the medications, because the side effects and miscommunication can be very harmful to the patient. That's the reason I chose this article, and certainly it really pertains to the course we are taking, trying to understand the better way to communicate in the field of medicine, which is healthcare. So without wasting much time, I'm going to go into the detail of the article. This was the kind of study performed in a general ward setting where the authors decided to look at the communication between the providers at different levels of the care regarding their medication intake. So they took 30 patients and they followed them from the time of admission to the hospital, the medications they were taking during the hospitalization, and the time of discharge, the list of medications they were given, and then followed them up later on in the home setting as well. The information was obtained mainly by the patients, from the patients, but there were certain situations where the home care and the families were contacted where they were the primary handler of the medication for the patient. So they interviewed 30 patients, and I'll give you some details of the numbers. They found there were a total of 250 drugs used. 50 medication errors were found affecting 18 of the patients. 27 errors were potentially harmful. Now, all the errors were classified and indexed according to the National Coordinating Council for Medication Errors. According to that, 23 errors were in category E and 4 of them were in category F. So let me explain to you what category E meant. Category E meant that errors were harmful and some kind of intervention was needed. So 23 errors, that's significant in 30 patients. And then other 4 were classified in category F. What F means that not only errors were harmful, but the patients require hospitalization. What it tells us that when you do such a small sample and you find those many medical errors regarding medications, that tells you that the problem is really, really big. Unfortunately, this paper did not address the previously done studies or talk about the overall incidence of medication errors, but I can tell you we also learned during this class early on that there are on average 400,000 medication I should say more of errors or communication errors in the medical field in the US alone, and half of them involve the medication errors. So it is amazing that we fail on different avenues to communicate with the patient. The problems with the study are that the sample size is very small. And the question addressed was that would errors end up in a harm or not? Well, I think it's very obvious that medication errors, when you have a different level of errors, they can end up in harm, and which we know that most of the time they will. So I think the question I would have asked more so to look at the magnitude of the problem and maybe get a bigger sample size and involve maybe multiple hospitals and see that how the problem, the extent of the problem basically. But at any cost, this study shows us even a small sample, you have a significant problem with medical errors, and patients can suffer from miscommunication. So at the end, I will leave you with 3 major questions, as I have posted those on my timeline. First question is, what is the best way to ensure that the patient's medication list is updated? And second question, and linked to that, would be, is primary care doctor responsible for updating that list and sending directly to the admitting physician? And third question linked to that would be, what is the role of patient? Should patient be more advocate of themselves to update the list and ask the questions so that the errors can be avoided? And my fourth question would be, are you updating your routine medication list, God forbid if you have to get hospitalized, so that you can readily produce that medication list for your admitting physician without causing further miscommunication? I look forward to answers and discussions on these areas on our leadership symposium, and thank you so much.